How does miliary TB affect bone marrow or eyes? Imagine a tiny army of bacteria spreading through your bloodstream, reaching parts of your body from the lungs. That's what happens in miliary tuberculosis, a serious form of TB that can affect multiple organs. Let's explore how this disease impacts the bone marrow and eyes, two vital parts of our body. When TB bacteria invade the bone marrow, which is the factory for making blood cells, they can cause inflammation and from small clusters called granulomas. These granulomas sometimes undergo a process called caseating necrosis, where tissue dies and creates a central area of dead tissue. This damage can interfere with the marrow's ability to produce healthy blood cells. As a result, patients might develop pancytopenia, meaning they have fewer red blood cells, white blood cells, and platelets. This can cause symptoms like fatigue from anemia, increased infections due to low white blood cells, and easy bruising or bleeding from low platelets. Although rare, marrow necrosis can further impair blood cell production, making symptoms worse. Diagnosing bone marrow involvement isn't always straightforward. Blood tests may reveal anemia, low white blood cell counts, or low platelets. To confirm, doctors often perform a bone marrow biopsy, where a small sample is taken and examined under a microscope. They look for granulomas and signs of necrosis. Sometimes, they can find TB bacteria directly, but often the diagnosis is made based on the presence of granulomas and clinical suspicion, especially in areas where TB is common. Treatment involves standard anti-TB medications, which can help control the infection and allow the bone marrow to recover. With proper therapy, blood counts often return to normal, and symptoms improve. However, if diagnosis or treatment is delayed, complications can become severe, highlighting the importance of early medical intervention. Now let's turn to the eyes. Although it's less common, TB can spread to the eye through the bloodstream, especially in disseminated or miliary cases. The eye is a protected organ, but TB bacteria can still cause problems. They may infect parts like the choroid layer, leading to choroiditis or cause uveitis, which is inflammation of the uvea. Retinal blood vessels can become inflamed, resulting in retinal vasculitis, or the optic nerve may become inflamed, leading to optic neuritis. These conditions can cause symptoms such as blurred vision, eye pain, redness, floaters, or even vision loss if left untreated. Diagnosing ocular TB requires a high degree of suspicion, especially if the patient has known miliary TB. Eye specialists may perform detailed examinations, imaging tests, and sometimes tissue biopsies. While finding TB bacteria in eye tissue confirms the diagnosis, often the diagnosis relies on clinical signs, imaging, and response to anti-TB therapy. Treatment for ocular TB generally involves anti-TB drugs. Sometimes corticosteroids are used to reduce inflammation, but only under strict medical supervision. Early diagnosis and prompt treatment are crucial to prevent permanent vision damage. In summary, miliary TB can rarely affect the bone marrow and eyes, but these complications are treatable. Recognizing symptoms early and seeking medical care can lead to recovery of blood cell production and preservation of vision. Always consult healthcare professionals for personalized advice. Remember, TB is a serious disease, but with proper treatment, many of its effects can be managed effectively.